Hi, this is Sarah Russell. And today I'm recording a video for all of you, especially clients who are out there feeling ambivalent about a recommendation that your medical provider may have made to start a medication, or feeling guilty about a medication that you're taking, or feeling some kind of shame around medication. This video is also for holistic health practitioners um, who um, who may be in a space where you consciously or unconsciously might create some of this ambivalence, stress, and shame in clients. So I really hope that that you will listen. I don't pretend that I have all the answers, but I really do hope that my perspective is helpful to you, and that you find it thought-provoking, whether or not you agree with my line of thinking or with the conclusions that I come to. I also don't want you to feel judged in any way if um, if if the perspectives that I'm sharing sound vastly different from yours. So I may say something that could make you think that I'm saying you're wrong. We may disagree, or I may disagree with your initial position, and you may change your mind, and all of those things are okay. I don't want anybody to feel judged or shamed by anything that I'm saying. Just imagine that we're having an in-person face-to-face conversation, and I'm sharing my thoughts, and you also have space for yours, for your thoughts and your feelings, and for disagreement and reconciliation. So I do hope that this framing is helpful to you, whether you are a client or a practitioner, or just a member of the general public who's just listening. So really important conversation today about medication. So it is very, very common for healthcare to be incredibly split and quite fragmented in today's world, especially it feels like 2021. My goodness, in the past couple of years, things have gotten, I feel like, a lot more fragmented than they were before, and a lot more, black and white, as if there were two different worlds that do not want to speak to each other anymore. One of the areas that this is particularly difficult um, for is people struggling with complex chronic health conditions. I truly believe that people who are struggling with chronic complex illness will benefit the most from having um, a network of healthcare practitioners who are truly integrating care um, from both allopathic and holistic integrative perspectives. Um, Most people with complex chronic illness will at some point need some kind of allopathic intervention. It may be a medication, it may be several medications, it may be a surgical procedure, it may be something, hospitalization, or, some kind of rehabilitation. You may need that, and that's okay. Um, and it is incredibly important for all the members of your medical team, of your healthcare team, to be on board with both the allopathic and the holistic um, spectrum of care that you're receiving. The more the people on your healthcare team are communicating with each other, respectful to each other, and cross-pollinating productively with each other instead of fighting, and making you feel like you are in some way having to work really, really hard uh, to get what you need from the various members of your healthcare team, the harder it is for you to heal. Um, when when you find yourself in a situation where you're judging yourself or feeling guilty, uh, or not accepting the idea of taking a medication that your medical practitioner feels that you might need. Um, this is an important opportunity to examine what's happening in kind of, in this, in the background. We are very complex beings. And yes, I mean, in the ideal situation, we would all have optimal health without needing any kind of medication. Wouldn't that be nice? Sometimes we just need medication. It's a phenomenon. You may be doing all the right nutritional things. You may be making the optimal lifestyle choices. You may be making a deliberate effort to get enough rest, relaxation, to sit down for meals, to chew slowly, doing all the right things. Or, you may be doing mostly the right things most of the time. Wherever you are on that spectrum of good nutrition and lifestyle choices, it is okay to also need a medication. This could be an antidepressant. This could be an allergy medication. It could be, something to support your digestion. It could be birth control. It could be thyroid medication. It could be some kind of a steroid medication. It could be a biologic drug. Now, what I'm saying is, in your situation, if you notice yourself having judgment towards your medical team for prescribing a medication, notice that, ask questions, make sure that that you feel heard, and that there's space for your questions. It is okay for you to ask, what can I try first? If you've already done all the holistic things, and your body is still not responding, it can make all the difference in the world to your quality of life to try a medication with an open mind. The more your entire healthcare team is cross communicating with each other and communicating with you in a way that is respectful towards you for the entire spectrum of your choices, and with respect towards the other members of your healthcare team, whether there is a personal, you know, connection between the various members on the team or not, whether they know each other personally or not. It is incredibly important for people to be respectful. And, I've seen it over and over again. People who are resistant to medication, who are doing most or all of the right nutrition and lifestyle things, who may be taking all the supplements, that have been recommended to them by their holistic team. They may be doing acupuncture, chiropractic, etc. When you finally say, yes, I'm going to try the progesterone, it may help you get pregnant and stay pregnant. It may limit, some of your PMS symptoms or migraine or whatever it is. When you accept the fact that you're going to try some allergy medication during the height of the pollen season, you may notice you're feeling substantially better and your quality of life improves so much. So give yourself permission. The same goes for, a thyroid medication. It can make a world of difference in the way that you feel. So try not to be judgmental to yourself. If you are a holistic health practitioner, it is really important that you try to support your clients in receiving integrative care instead of using disparaging language, either explicitly or implicitly, towards the world of allopathic medicine. Because your clients will be more supported and enjoy better quality of life if everybody is being respectful and there is truly integrative care. I actually discovered many forms of holistic healthcare through the recommendations of allopathic medical practitioners. My first and perhaps best acupuncturist was also a medical doctor. She was my gynecologist. Um, I discovered an incredible world through an open-minded allopathic medical provider. And it could be partly because of the really great people that I've met in both the allopathic and holistic medical world that I'm a holistic health practitioner myself. Um, I have also encountered my share of very judgmental allopathic and holistic providers. I personally don't care to really have people like that on my team, because I think that that is kind of a toxic mindset that doesn't really contribute to to my best health. I also try to help my clients build a healthcare team that is composed of people who are collaborative and who are truly going to put the client at the center. So if you are a provider, please keep all of these things in mind. Your client will feel better when everybody is really putting the client at the center. If you are, a client, you could be a client of mine or a client of some other holistic health or allopathic health practitioner, or you're a member of the general public. Who's just listening in for your own learning, it is a red flag anytime someone on your healthcare team pronounces judgment, or anytime you pronounce judgment on yourself implicitly or explicitly. Notice, try not to judge, just notice, be curious, be open. Where are these thoughts coming from? What can I do about it? Why is there this resistance? What can we try next? Um, if you try a medication and it doesn't work, you can always stop taking it. Of course, discuss with your medical doctor before starting, stopping, or changing the dosage of any medication. This is incredibly important, because there could be unexpected consequences, and some medications really do require careful titration, both when you're starting them and when you're stopping them. So don't just try to do this on your own. If you have any kind of adverse reaction to a medication or a supplement, inform the prescribing provider immediately and let them know, and safely address that. Um, but what I'm saying is that it is really important for you and for all the members of your holistic and allopathic healthcare team to support your best health and to act in your best interest. This means leaving aside judgmental, disrespectful, and dogmatic ideas about what is best. Um, what really matters is your best interest. Um, we may feel a certain way about medications. We may feel a certain way about, allopathic psychiatry. We may feel many different things, and that's okay. But we have to leave all of those things aside when we're trying to understand what is best for ourselves and for our clients. So I hope that this is helpful to you, whether you are a client, a member of the general public, or a healthcare provider. And I hope that we can heal ourselves and heal relationships in the world right now that, it's just such a fragmented and fragmentary time. And this is not an attitude that contributes to general overall health. So I hope that we can be kind, that we can learn more, that we can be curious, and that we can really help healing in the true and genuine sense of the word healing. Healing comes from the word whole. Um, Healing is about wholeness. Anytime that we are on a pursuit for healing, it's really important to keep in mind this vision of the whole person, the whole picture. How do the parts fit together? It's not about good or bad. It's really about the whole. How do we connect the dots to understand what is going on? How do we connect different modes of improvement for the person's health? How can we help you feel as whole as you possibly can, so that you can be healthy? Um, with those words, I hope that you will reach out with any questions and any experiences that you want to share. And have a wonderful day, and definitely stay tuned, because I'm going to be creating more videos like this. Let me know if you have any particular topics that you would like to suggest. I look forward to hearing from you. Bye.